Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Retinal detachment. In the retinal detachment, first we have rhegmatogenous retinal detachment. So the cause of rhegmatogenous retinal detachment. Rhegmatogenous retinal detachment mainly occurs due to the break. Why is there a break actually? Okay. Here, rhegmatogenous retinal detachment occurs due to a break. Why is there break? The break can be due to the traction or trauma or some predisposing degenerations. All these will result in a break will occur. Okay, through the retinal pigment epithelium, a small break will occur. So this is the reason for retinal pigment epithelium. Then clinical features of retinal pigment epithelium. In the clinical features, the patient presents with either photopsia or what are photopsia? Photopsia are opacities in the vitreous cavity. Sorry, floaters. First, the patient will present with floaters or photopsia or decreased visual acuity. First, floaters. Floaters are because of the retinal detachment in the vitreous cavity, because of the opacities which are found, because of this retinal detachment, the floaters are seen. Photopsia is presence of flash of light which is seen by the patient is photopsia. This flash of light mainly occurs due to the irritation of rods and cones will result in this flash of light. Decreased visual acuity is also seen with visual field defect is common in rhegmatogenous retinal detachment. In rhegmatogenous retinal detachment, a convex configuration is seen. What does that mean? That means actually here the retina will be something like this. So this is convex configuration. Sorry, this will be something like this. Okay, so this is convex configuration. No, sorry, this is correct. The previous one is correct. Yeah, a convex configuration is seen in retinal detachment. Then treatment is, so in the treatment we can do scleral buckling can be done, or we can also do vitreoretinal surgery, or pars plana vitrectomy is done in the patient. So this is rhegmatogenous retinal detachment.
thank you and thank you for watching.